Hello guys, so let's talk about mandibular and maxillary torus, okay, or tori, so this would be the plural. And we know that those are bone exostoses, so bone growth, okay, out of the limits of the alveolar bone ridge, out of the normal limits, of course. And then a bone enostosis would be when we have the cortical bone growing in the places that we usually have trabecular bone. Okay, just like the top left corner of your screen now. So let's discuss about this because those alterations usually they appear in the same patients. Okay, so it's very common that a patient with torus will have some bone enostosis areas, okay, or dense bone islands or idiopathic sclerosis. All right, so there are some names that you can use. There are also some different or differential diagnoses. We are going to discuss this now. All right, so this topic is about radiopaque alterations. So if you guys are wondering about the origin of tori or torus, so why they happen, well, this is a very nice article that we did when I was in Canada, and it's basically about the origin or the etiology of the torus. Okay, so it can be related to parafunctional occlusion and to the shape of the mandible, but there are some some aspects that we should consider as well. So I really recommend you guys to read this article here. Okay, don't forget also to see the video of radiopaque alterations. So I will add up the link in the top right corner of this screen, so it will show up at some point. Okay, so of course you guys know that the mandibular torus, for example, is most commonly bilateral. Okay, it can be not bilateral as well, but then sometimes you can, you cannot see it actually in the 2D radiographs. It's unlikely that you are going to be able to see it unless it's very dense and very large. Okay, so here we have an example. All right, the image on the top left corner of the screen here, and you guys are seeing that there is. Take a look at this. So we have the lingual plate here being thicker, right? So that's the lingual plate of the mandible at the site of the canine and the premolars, where we have the lateral excursion, usually the canine guidance. Okay, and then we have also the bone enostosis happening here at the same time, right? So how to describe the bone enostosis here? So this would be, of course, a well-limited, homogeneous, okay, round lesion. So you can say that the shape is round as well, or rounded. And then we have here the continuation of the lesion with buccal and lingual plates, okay? So they are actually happening at the same time here. So we can see that the lesion is in continuation with or contiguous to the buccal plate and then the lingual plate as well, all right? So this is very common for bone enostosis, okay? And then we have here the lingual plate showing, okay, so the lesion is showing on the 3D reconstructed model. All right, so this is a 3D reconstructed model of the case. There is not a horizontal bone loss, so you can see the horizontal bone levels, especially in the 2D images. Of course, those are the ones for us to diagnose this. And then the shapes of the mandibular, submandibular fossa, okay, and then the torus is here, always in the cervical third of the alveolar ridge, not the apical third. Okay, so always in the cervical third. That's the common appearance of the mandibular torus, okay? And then that's how you would see in a cross-sectional image, okay? So the green arrow over here on the top left image, okay? Now we are seeing now this case on the bottom left of your screen, and then we have the palatal plate with a bone exostosis as well, all right? So this is happening at the site of the premolar. We do have a rotated canine. So the canine is rotated distally, and then we have the torus. Okay, so not torus, the bone exostosis, right? So that's the bone exostosis. Why I'm not calling this maxillary torus yet? Because the maxillary torus is usually the definition is the palatine torus, which happens in the sagittal midline of the patient. Okay, so let's discuss now this type of cases. So we have here my software of CBCT. Let me show to you guys now. And then we have the maxillary torus. Okay, so take a look at this. Here we are seeing the torus, and of course that's cortical bone. Okay, so you can compare with the density of the trabecular bone. Okay, here on the sagittal plane we can see the nasopalatine canal, okay, and the incisive foramen, of course, and then posterior to that we have our palatine torus. Okay, so on the axial view, the palatine torus, I can see the thickness of the palatine torus, but of course the height and the width of the palatine torus I can see and measure. Okay, I can even perform linear measurements using the coronal plane. Okay, so that's the image of the coronal plane. All right, so don't forget about this because those are also very important information. Okay, so if you guys like, please hit the like button and see you guys in the next videos.